Our first speaker today is Dr. Camilla Björn. So Camilla, warm welcome. Camilla is one of the leaders of Antibiotic Smart Sweden, and she works as a researcher and project leader at the governmentally owned RISE, Research Institutes of Sweden, where she also leads their focus area infection management. Camilla, the floor is yours.
Thank you so much, Kerstin. See if this works. Can you see my screen?
Yes.
Great, thank you so much. So, Antibiotic Smart Sweden is an initiative funded by the Sweden Innovation Agency Vinnova and participating partners. And we use a mission-oriented approach where different sectors and organizations and actors work together with a portfolio of different activities towards a common, bold and inspirational mission in order to meet a grand societal challenge, which in our case is antibiotic resistance, or AMR. And our mission, or perhaps you call it a vision, is Antibiotic Smart Sweden. And that is a society where everyone helps to keep antibiotics working and saving lives. And Antibiotic Smart Sweden is led by Public Health Agency of Sweden, together with RISE, Research Institute of Sweden, and together with REACT, Action on Antibiotic Resistance, and Strama, the Swedish Strategic Program Against Antibiotic Resistance, the four organizations together form the core team of Antibiotic Smart Sweden. And we also have 2 municipalities and 4 regions as our participating partners. But in addition, we collaborate with many other organizations and community representatives. But before continuing, some brief words about the Swedish model of government, which consists of 3 levels. And at the national level, we have the Swedish government, and then Sweden is divided into 21 regions or counties, and these are responsible for healthcare and public transport, etc. And then at the local level, Sweden is divided into 290 municipalities, which are responsible for a broad range of public services. So to achieve the mission of an Antibiotic Smart Sweden, we want to inspire and motivate all parts of society to engage and to help them understand their role and how they can contribute. And we want to build knowledge and create structures for individuals and organizations to make antibiotic smart choices. That is to prevent transmission of infections and to use antibiotics wisely. And we want to do this together with the society. And central in this work has been the development of antibiotic smart criteria, or criteria for antibiotic smart regions and municipalities and their different sectors, as can be seen in this figure. And these criteria have been developed together with the representative from the different area for which the criteria will be used, which is of course very important for us. And the criteria function as kind of a toolbox for systematic improvement work for important areas to address within each of these levels or sectors. And generally, the criteria covers organization and collaboration, measurement and follow-up, routines and working methods, education and professional development. And the number of criteria varies from sector to sector, but ranges from 5 to 20. But to give you a bit more specific, to give you some examples of how the criteria could look like, I will give you some examples from the municipalities. And then at the governance level, the criteria include to make a political decision and that the municipality and its sectors should work for antibiotic smartness, and also to use AMR criteria for procurement of food. And criteria for elderly care includes, for example, measurements of healthcare associated infection and antibiotic treatments at the facility, and also set up an action plan based on the results. And for preschools, criteria include to appoint one of that staff as a hygiene representative who can support the implementation and follow-up of infection prevention routines, and also to perform educational activities for children. And the criteria for school include, for example, competence development for staff and educational activities for students. And for water and wastewater organization, criteria include measurements of selected antibiotics and bacteria in outgoing water from the treatment plants. So the criteria have or are now pilot tested at more than 60 different sites all over Sweden. And the criteria are then evaluated and revised together with the pilot sites. And now we prepare for a wider rollout of the criteria next year. And there we will also introduce the possibility to be designated antibiotic smart if you fulfill the criteria. So antibiotic smart municipality, region, or organization such as school or elderly care facility, for example. And we also have discussions to expand the criteria to other relevant areas as well, for example, veterinary sector. And in parallel to this, other work is also ongoing at Antibiotic Smart Sweden. For example, we want to engage citizens, and we want to do that in a more structured, systematic way. And we want to use behavioral insights to address different groups in society. And we also want to work with both new and established channels or contact areas to connect with the citizens, such as libraries, art exhibitions, pharmacies, and courses in community orientation for newly arrived immigrants. And we also strive to provide a platform for collaboration and to share experiences and good example, both nationally and internationally. So that was my last slide. Thank you for your attention, and please visit our website or contact me for more information. Thank you.